Hello, this is debunks at KOSA Acupuncture in Gaithersburg, Maryland. Today's subject is the episode number 7, Health Info by KOSA Acupuncture. And I'm going to tell you about hypertension myth. Simply to say, hypertension is not a disease, but a part of a self-healing mechanism. Thus, you may not want to lower your blood pressure artificially because it might confuse your body, and more importantly, your body may become vulnerable to other diseases. So we're going to talk about historical perspectives on management of hypertension and opinions on them and debunking the myth and effectiveness of hypertension drugs. And also you need to know the side effects of the hypertension drugs and what you need to do to lower blood pressure naturally. And lastly, important note. So let's talk about the history. Okay, this column is systolic pressure and this is diastolic pressure. So up until 1949, 210/100 was the threshold to tell people you're with a high blood pressure or hypertension. Up until 1979, JNC1, the guideline was 160/100. Based on JNC1 in 1979, they lowered it to 140/90. Or, depending on the source, they didn't care of systolic pressure, so it was disregarded, and diastolic pressure was 105. And from JNC7 in 2003, they lowered it again to 130/90. In 2013, if people were 60 years old or older, 150/90. And if 59 years old or younger, 140/90. From 2017, they lowered it again to 130/80 or 140/80, depending on organization. JNC is the Joint National Committee on Prevention, Detection, Evaluation, and Treatment of High Blood Pressure. Okay. So here, the thing is, lowering the thresholds of high blood pressure have failed to improve people's health. On the contrary, people have been getting sicker with a higher rate. So you may have a question: might lowering guidelines have created more patients? Well, you'll have to think about it. Okay, so please take a look at below article at American College of Cardiology about former President Franklin D. Roosevelt, which may convince you that our body is made to withstand up to 300/190 or even higher. Once his blood pressure was 188/105 in 1941. In February 1945, his blood pressure was 260/150. On the morning of April 12, 1945, the blood pressure was 300/190. So this tells us that even though it is dangerous, still our body is designed and created to withstand this high blood pressure or even higher. And let's have a look at the opinions on the management of hypertension. In 1931, John Hay, professor of medicine at Liverpool University, wrote that there is some truth in the saying that the greatest danger to a man with a high blood pressure lies in its discovery, because then some fool is certain to try and reduce it. And in 1937, U.S. cardiologist Paul Dudley White suggested that hypertension may be an important compensatory mechanism which should not be tampered with, even if we were certain that we could control it. Charles Friedberg, 1949, in his book, he said, people with mild benign hypertension need not to be treated, which means up to levels of 210 over 100. Maybe you may think, because these are old theory, they could be wrong. We'll see. Just because many people with good credentials say hypertension is dangerous, it doesn't have to be so. Our body has amazing self-healing power. In fact, KOSA Acupuncture understands that the hypertension is not a disease, but an indication of unhealthy organs or the whole body, and it is a proof that heart is healthy enough to do its job of self-healing. Well, if heart is not healthy, then how can it withstand higher blood pressure, right? Actually, having low blood pressure is a disease. There is a problem with the heart. Having higher blood pressure? No, there is no problem with the heart. So, let's talk about the myth. Number one, hypertension causes heart failure and heart attacks and that kind of stuff. You have been told so many times, and I'm going to skip it. So let's all have a look at this. Hypertension is the indication or reflection that your body is trying to fix the health problems, whether you have noticed them or not. Unless pain or symptom is due to injury, even before it is noticed, organs have already started to fix the problems, and of course, blood pressure will have to be raised to expedite the healing. Because our body has to have a higher flow rate of the blood. Even though you are perfectly healthy and your blood pressure was 120 over 80, having pain will raise your blood pressure because your body needs to fix the damage as soon as possible. Kidney is a filter, and when it becomes unhealthy or clogged, the blood pressure has to go up because heart's job is to maintain blood flow rate as needed, not to maintain blood pressure. The more oxygen needed, the higher blood flow rate shall be maintained, and therefore the blood pressure has to go up. If the blood pressure cannot go up to meet the demanded blood flow rate, then you will be in bigger trouble. Don't you agree? Once again, kidney failure and other conditions like the above is the cause of hypertension, not vice versa. As a conclusion, you will want to lower your blood pressure by fixing your kidney. For example, if unhealthy kidney is the cause of hypertension, of course, not by any other methods. When you try to lower your blood pressure by any other methods than fixing kidney, for this case, you will end up having more problems than ever before due to insufficient blood flow rate and so on. Myth number 2, systolic pressure of 180 is dangerous. I would say no, it is not. It is still deemed safe. It's normal for systolic blood pressure to rise to between 160 and 220 during exercise. Thus, even when the above blood pressure, you just have to take rest. You need to take rest anyway when you are not healthy, right? Myth number 3, sodium increases blood pressure. No, it doesn't. And at the same time, yes, maybe because when you take too much sodium, of course, it will harm you. No matter how good it is, if you take it too much, it is too much. Simply, and again, too much is too much, like drinking water. On the contrary, too little is too little. And there was research, data from 2,632 men and women aged between 30 and 64 years old. So the outcome was, over the 16-year follow-up period, the researchers observed that the participants who consumed under 2,500 milligrams of sodium each day had a higher blood pressure than those who consumed higher quantity of sodium. So just because of sodium causes hypertension, no. That may be true, that may not be true. So you need to be smart. According to KOSA, which is the acronym of a Korean Orthodox Acupuncture, is the theory, salty taste is categorized in water, which is supposed to help kidney, bladder, lung, and large intestine. Again, when you take it too much, of course, it will harm you. When you take it too less, it will harm you too. Now let's talk about effectiveness of hypertension drugs. It is common that once you are on hypertension drugs, it would be pretty much impossible to get off of it, because it is not to take care of root problems or causes, but to manage the blood pressure only. Because with a lower blood flow rate than needed, the reversal would become more difficult or even impossible, not to mention the chance of the other organs getting unhealthy or unhealthier. Because, for example, although it is said that calcium channel blockers relax and widen blood vessels by affecting the muscle cells in the arterial walls, not all blood vessels would be evenly relaxed and widened, and blood vessels may not be the only body parts affected by calcium channel blockers. Because dosages prescribed usually are more than needed, and there is no way to make the dosage exactly same as needed, as our body has conditions continuously changing 24/7. The dosage your doctor prescribed is a guesswork, and it cannot be accurate ever. Now let's talk about side effects of hypertension drugs. The reason why I chose lisinopril is this is the most popular hypertension drug prescribed. So Please keep this in mind because it's very important. And not many people think of this. According to our theory, liver is in charge of muscles, ligaments, eyes, vision, anger, and reproductive organs, in addition to conventional medicine thinks. According to KOSA's theory, kidney and bladder is in charge of bones, metals, spiritual energy, willpower, hearing, ears, fear, and reproductive organs, in addition to conventional medicines things. Also, please don't forget to refer to below warning at drugs.com, keeping in mind that conventional medicine doesn't have perfect tool to fully diagnose kidney and liver. To make sure lisinopril is safe for you, tell your doctor if you have ever had kidney disease or if you are on dialysis, liver disease, or high level of potassium in your blood. Again, even though they say your kidney or liver or both of them are perfectly fine, that does not mean that it's true, because conventional medicine does not have a perfect tool to diagnose your organs accurately. In addition to the above, please bear in mind that the term of very common, more common, less common, uncommon, rare, and very rare mean nothing, because nobody knows who will suffer the side effects, even though the side effect is categorized in very rare. Once it hits you, you will have it, even though it is categorized in very rare cases. Lastly, not feeling any one of them does not still mean it doesn't harm you. There are people didn't notice any conditions until they are told they are with terminal cancer. So when you look at this, lisinopril side effects, your blood vision means liver damage, cloudy urine, it can be kidney and liver, confusion is liver, all sort of things. Okay? Now, what you need to do to lower blood pressure naturally is, firstly, avoid anything can and may harm your health. Secondly, learn and do right things to do. Lastly, refer to KOSA Acupuncture's blog post. Everything about food and health and healthy info by KOSA Acupuncture. I have posted 6 episodes, and again, this post is about the 7th episode. Please subscribe our newsletter and share it with your friends so that you and we can help them better. You just have to click on this button. And finally, important note. Once the above are explained to patients of KOSA Acupuncture or mine, they usually stop hypertension drugs immediately and their health conditions get improved faster. So if you want to know more about hypertension, please refer these articles on my YouTube channel and the forum. Please be aware of that your body's ability to heal is greater than anyone has permitted you to believe. Listen to your body, which knows how to heal itself. Numbers, what I mean here is blood pressure, cholesterol level, any other number after a certain test does not mean you are supposed to be unhealthy or healthy. Numbers are just numbers. There can be exceptions. And even though they say you are supposed to be sick, you don't have to be sick. Thank you very much and have a great day. Bye.